So I've got Scott Boden here today. He is a SpexHair trusted surgeon. I have been fortunate to be associated with him for a number of years. And it's fantastic to have Scott on today to kind of just, break down a few important questions that patients notoriously ask. And it's fantastic to get such an experienced and ethical surgeon's insight. So, I mean, Scott, you're widely known for creating extremely age-appropriate hairlines. From an artistic and surgical standpoint, what are the key elements that separate a believable long-term hairline from one that looks manufactured and forced, would you say?
Yeah, that's such a critical part of what has to be done right. Sort of, I've said this to probably every patient. If someone can identify that you've had a hair transplant, then it's not a good one. You know,
Indeed.
if you take that as the focus, listen, we want to do something that's going to look natural for you. And in order to do that, there's medical knowledge that goes into doing what I do. There's surgical skill that is important. And there's an aesthetic judgment that's absolutely critical. And I kind of think in my mind that a successful hair transplant doesn't ever draw attention to itself. It draws attention to your eyes. I think in the context right here, there are two guys of you don't look at the hair first, you look at the eyes first. And so if we can create that and create that proper balance of perspective where people greet you, and that's really what people want.
Indeed.
I see a guy in his 20s or 60s or even old 80s, I've had the common refrain is, "I'm just tired of people glancing up and over at my head. I don't want that up and over bald look." So to focus the attention downwards so that the eyes are what people see, that's I give you another analogy. More than you asked for. I have a number of patients who are dentists, oral health professionals. And when they come in, I say, listen, if you've done your work right, you want people to say, you've got a beautiful smile. Not, you've got beautiful teeth. What great caps you had, So,
Indeed.
so when we think about a great hairline, it's a sort of a zone of transition from, the forehead to the scalp. And the paradox is we want to do such a good job that people don't even identify that it's been done.
That's a great analogy, and one I've never heard in all these years of being, involved in this space. And it's so true because the hairline essentially frames the face.
Yeah.
When you're looking at a picture, you look at the picture, you don't look at the frame it's in. And that is exactly the same kind of analogy as well. So no, that's really great to get your insight there. And
Yeah.
leading into like kind of transparency in this incredibly noisy industry. You've been around a very long time and you've experienced and witnessed a high number of kind of consultations and patients and demands, and you've seen it all. But with so much marketing noise and confusion and like kind of confusing information that's out there, how important is transparency in consultations? And what should patients expect from an ethical surgeon like yourself when it comes to setting kind of realistic expectations and building that trust early on with the surgeon?
Yeah. It is paramount, right? Like ethical, honest, transparent conversation with a skilled surgeon is critical. It's a critical first step. Transparent consultation is critical. And you mentioned something which is exactly right in terms of expectations. And I'll tell people, the the best hair transplant in the world, the most technically sophisticated transplant will not be a success if it hasn't met your expectations.
Mm.
And I'm very clear with people. I say, listen, here's what's available. Here's the supply. Here's the demand. Here's what will look natural. Will you look like you were 16 years old again? No. And if that's your expectation, well, we shake hands and I'll send you out for a cup of coffee. We can't meet that expectation. And I'm very transparent. If the expectation is, I want to look like maybe roll the clock back a few years, or I want to feel less self-conscious. I don't want people to notice I've changed anything about my look. I just want to not feel self-conscious, and that's my goal. We can do that, and that's magnificent. And that's why I've been doing this, and I find the work so rewarding. It subtracts that sense of self-consciousness. It's very gratifying professionally and personally when people come back and say, I feel great. Oh, my hair's good too.
That's great. It's really important to have that, to pull the Band-Aid off and just give patients realistic expectations. Sadly, in this space, I'm like a clearinghouse for complaints. Too many are led or told what they want to hear and not what they need to hear. And that's why we've been associated for so many years now, because, I'm proud to make sure people are made aware of you, because I know if people come for consultations with you, they're going to get the facts. They're not going to be misled. They're not going to have the old, bait and switch, which is all too common in this space. But, you know, leading into that, it's like protecting young patients from kind of impulsive decisions. And I mean, young men often come in feeling very desperate. I was one of them, and kind of wanting an instant kind of fix. And sometimes asking for low hairlines that kind of won't be, only too well, age appropriate in even 5, 10 years' time. So, how do you approach those difficult conversations kind of, responsibly? And what do you wish kind of every young patient would understand before considering surgery?
I really appreciate that question. I always will say our goal here is your long-term success. And sometimes I'll see a 26-year-old or 23-year-old who says, "Yeah, I know, but here's where can't you see where the hairline is?" I say, "I know where the hairline is. And if you look at your dad, your grandfather, your uncles, and the natural expectation is you're going to get older, your hairline will rise up a bit. We want to lock it in at a point that's going to look natural as you age." And sometimes I think, to your question, I get pushback. Well, I'm only 23. I want it where it is now. I want it like a long time ago when I was 18. And that point, I said, let's sort of plan this out. Let's pretend you're a bald guy. I'm not bald yet. Okay, let me show you a picture of a bald guy, and let me draw the plan you want on this bald guy. How does that look? Oh, it doesn't look real. Let's draw
Yeah.
something that makes that older guy look like a younger guy, not 23, not 18, but let's try to envision you and peer over the horizon, the timeline. And it is a long conversation. And the other piece of this, which is important, I think it's a bit of a rambling answer, but I'm very collaborative. You know, I don't I won't ever do something that is wrong for the patient. Like, if a patient insists, "This is what I want," I say, "Listen, I appreciate what you're saying. I'm probably not the right doctor for you, and I wish you the best." And I maintain my own integrity and I do the right thing for the patient. And I think when I say, "Don't do that, I don't think that's in your best long-term interest. Let's talk about how you can put the brakes on any further loss." That's an important part of every conversation, and we'll get to it. Stop losing hair. I'll be happy to follow along and I'll be your hair doctor, but I don't necessarily want to be your hair surgeon until we come to a point of understanding. And this goes to transparency and ethics, and not just, "Oh, you got the money, I'll take it." That's not how I do it.
No. And I know that. Hence why, I'm very kind of eager for people, especially in your area. And I know people who've traveled over the pond to see you from this neck of the woods, because too many young guys I was one, and I remember thinking, and I hear it still, but I won't care in 10 years' time. I won't, it won't bother me then. And I'm like, oh, I remember getting my first hair transplant at 21 years old. I'm just turned 50. And it's like, whoa, trying to help educate those patients is a difficult task. But, leading into that, it's like combining the importance of combining medical therapy with kind of surgical therapy. And it's like you've always emphasized that surgery is just one part of the long term game plan in terms of achieving the most successful outcome, and how you integrate medical treatments like finasteride and minoxidil. I've seen many of your Instagram clips of late discussing the importance, and obviously combining that with kind of your surgical strategy to help patients protect their investment, not just short term, but long term. And, it's important, isn't it, that patients realize they've got to put that foundation in place if they want to build the wall to stand the test of time.
Yeah.
So, I mean, how do you approach that with your patients, especially the younger ones? I mean, you must kind of reiterate the importance of getting on medical therapy before we even consider surgery. Yeah.
Right. No, I think we're simpatico here. Like we're on the we both agree, and we both had a lot of experience in in this field, and know the value of long-term maintenance. And that's a very important part of every conversation I have with my patient. You need to keep what you have. We'll find something that works. There's a lot of effects. There's a lot of misinformation, and some people will have side effects. There are, in my practice, it's going on a few decades now, I have never encountered anybody with permanent side effects. So I think we can talk about how to mitigate any risk of side effects. I've really embraced some of the regenerative therapies. More important is the stabilizing therapies, which are now available topically. So the topical finasteride, dutasteride, obviously minoxidil, oral or topical. There are a couple other things I'll mention, which I don't see out there as often as they should. Topical progesterone is something that is a competitive inhibitor. It blocks the ability of DHT to get
Interesting.
into the follicle. I've been using that with good success. Topical caffeine has a role. Low dose topical anti-inflammatories. Topical latanoprost, which is the ingredient that can grow eyelashes. So
Yeah,
there are a
yeah,
lot of
yeah, yeah, definitely.
and so there are sophisticated ways to use compounded medications customized for each individual patient. And it just becomes sort of once you here's something else I'll tell people. I said, listen, I'm certain you brush your teeth every day and it just becomes a habit.
Mm.
If you if you get in the habit of doing this topical once a day, you get in the habit of taking medicine once a day, you don't think about it, you just do it. And it's part of health maintenance. It's part of, owning your own good health and taking care of your hair and your appearance is part of that.
Well, again, I mean, discussing analogies, it's like we brush our teeth twice a day. It's like to maintain your teeth. So there's no difference in wanting to maintain and preserve the integrity of your hair, you know? But no, it's important. But nonetheless, it's like when these patients that we deal with on a daily basis, it's a very difficult kind of thing for them to hear when, you know, an ethical surgeon will tell them that surgery isn't necessarily your best option here.
Right.
So because they want that quick fix. And one thing I've preached for years in the mainstream media, and I've been fortunate to have quite a voice, and a lot of well, many ethical surgeons agree that surgery isn't your first port of call. Can you share situations rather where you've advised completely against a hair transplant and why that kind of honesty is crucial to protect patients in the long run?
Yeah, I love that. Every consultation, I have a large file of medical therapy only patients.
Brilliant.
And I think everybody walks in here, it's a bit of it's a leap of faith. It's a bit of a challenge for anybody. I see, probably my patient clientele is 70%, 75% men, but men or women with hair loss, nobody wants to talk about it. It's embarrassing. It's sort of a concession to aging and mortality, and there's a lot to it. And to be able to put a person at ease and say, I'm going to help you. I'm going to take care of you. Surgery may be an option for you down the line. It may be an option today. Let's have that discussion, but that's not where I start. Let's talk about maintenance. I want you to feel hopeful. I want you to see some pictures of guys who might have been in your situation. They did these medications I recommended, A, B, C, and D, and they feel better. Their hair came back, or at least they stopped losing hair. And it's interesting. People come in here often feeling pretty dejected, like, it took me 10 years to make the phone call, right? Or,
Yeah,
no,
yeah, very common.
nobody wakes up on a Tuesday and says, "Oh boy, this bothers me now. I'm going to do it." It's been going on for a long time. And to say, listen, it didn't start yesterday. We're not going to fix it today, but we can get you on the right track so that you'll feel better about yourself and you'll have less hair loss. Maybe you'll see some regrowth. I think that's an important part of every conversation. And I think you alluded to this. Everyone wants a quick fix. I want to get it fixed. This has been bugging me. I just got another comment from my friend, my girlfriend, my whatever. I saw that picture and as I walked out of the store
Yeah.
and that camera, oh my God, you know, um, I want to fix it today now. Now, it doesn't work that way. And if we can express honest concern and if patients know they're cared about, it goes a long way. This isn't just, I'm here to sell you something. You're not a good candidate. See you later. I'm here to take care of you. I'm your doctor, and you're seeing me with a medical issue that I know how to address. Let me help you, or at least let's get started on that path.
You
Surgery
reminded
may be the right option, but
you
not yet.
reminded me of something there that's quite reminiscent for me, because you just highlighted like when people see their pictures. And now, with this busy festive season ahead of us, a lot of pictures are taken, a lot of, which aren't necessarily normally taken, but this festive season does generate a higher level of interest shown in resolving their hair.
Yeah,
I've seen it year in, year out. Come January, so many inquiries are coming in, and when you break it down, the trigger for it has been, well, I saw the pictures of me around the dinner table, over Thanksgiving or whatever. So it just made me laugh that, as you well know, after being in practice for so many years, kind of January is just like a very particularly busy month. And you have to
yeah,
ask yourself, why is this? And it's like, because people essentially are kind of seeing themselves potentially, in photos over that period. And it always makes me laugh. But I suppose just to kind of, summarize now, in the role that I play in this space, and you've been familiar with my work and been a big advocate of what I do, you've been very aware how important patient advocacy and transparency has been
yeah.
in helping the industry. And from your perspective, how vital has it been to build genuine trust with patients, having kind of educational resources to point patients in the direction of, to help them get educated via a third party? Because patients will come to you and it's like, yeah, well, you're going to tell me that, aren't you? But you've got an invested interest, whatever that may be, but
Right.
how important has it been to you to be able to say, look, if you don't believe what I'm saying, here's a resource to go and get somebody else's opinion who's been through it, done it, and get educated that way.
Yeah. I appreciate your asking the question, and I deeply appreciate uh, your advocacy and your responsibility that you've taken on as a advocate for consumers. It's a sort of a scary world out there, and and then with AI, anybody can look like anybody and anything, and so having I guess I'll use the term a third party, but not just a third party endorsement, but third party information. Go out there and do your research. And the research may be, these are other doctors that are very ethical that I think you should see. Here's a good list of doctors to consider. Here are doctors that are devoted to this specialty that you'll meet the doctor. You're not just going to meet a sales guy, someone,
Somebody, colleagues that you know are going to give them a really good, valuable, honest
yeah, no, but see
appraisal.
exactly the honesty and ethical approach. Spencer, I'm not exactly sure how to best articulate this. There's pressure. Someone comes in with vulnerability.
Hmm.
You know, anybody who is seeing a hair transplant doctor is considering that, is trying to address an underlying vulnerability that they don't feel good about.
Yeah,
Nobody's,
100%.
whatever it is. And it takes a care and gentle respect to not abuse that vulnerability.
That is the word. That is the
Or maybe
word.
exploit is the best word. The idea that someone's gonna, God, this has been bugging me, and this guy went to this other country, or this guy saw this doctor in this other area, and I want my, like, let's address the underlying feeling. I mean, I'm not a psychologist or psychiatrist, right? But let's recognize that there's a vulnerability. I'm not here to exploit that. I'm not here, and of course, you can, encounter people saying, whatever it is, I'll just do it. How soon can I get this done? And I'm the one saying, let's just slow the pace a little bit and at least have a conversation about steps to take. I'm here for you. I have had a couple of patients that say, listen, I know you're anxious to do this. I'm
Mm.
happy to be your doctor. Maybe we'll get to be surgeon, but at least doctor for now. When you go see the other guy who I know you're probably going to call, and when you go next, someone says, yes, let's, show me the money. We'll put you in next Wednesday. Call me and I'll talk you off that ledge and say, just slow down, take a deep breath. It's not patronizing. It's just saying, let me think with you about your long-term success. You got to be honest and respect people's vulnerability. I mean, it's an interesting field we have, isn't it?
Yeah, but that integrity that you have shone through for so many years, and that's always been the case with so many patients that I've spoken to that have been to you for guidance. And that's why, I'm so proud to have you involved with SpexHair and everything that I'm involved in. And I was a patient who was taken advantage of at a young age of 21. I know what it's like to be sold what I wanted to hear. And that's
Right.
why I took the time, and my journey was quite unique, but I felt that that's why it was so important to make sure that patients didn't make the same mistakes that I make, which sadly people still are making today because the market is, it's such a big marketplace now. And with medical tourism and so many different clinics that have their bottom line to me are selling surgery to people, to young guys as well as older guys that just aren't eligible candidates. And sadly, the repercussions of that are tragic. And I know you have to deal with a lot of repair patients, and that is what I have set out to try and avoid is patients becoming repair patients, not preventing them from having surgery. But if you're going to take this leap of faith and have hair transplant surgery, you must do your due diligence and you must at least consult with reputable, honest surgeons who are going to guide you. And that's why it's brilliant to have you, involved in everything and making people aware of you so that they can be guided in a much safer direction. So, Scott Boden, I'm so pleased to have had you on today. And we must kind of make sure we do this on a more regular basis and address other questions. And hopefully we'll get some questions asked to us that we can, I can fire at you next time round. But, for the most part, I really want to say thank you so much for coming on, and we'll speak soon.
Well, it's my honor to speak with you, and I deeply appreciate all the work you do, Spencer. Happy, you continue. You're sort of like the ethical, the face of taking an ethical, transparent approach in a world that's pretty scary.
Yeah, well, I
And
appreciate that. Scott, can we
you're doing
continue?
a great deal. You're doing a lot of good.
Thank you very much.